So let's just start off with a quick overview of the University of Alberta. I'm not entirely sure where everyone's joining us from today, so if you're not from Alberta, you may not be familiar. University of Alberta is located in Edmonton, and we are a top 4 university in Canada and a top 100 university in the world. These are rankings that we highly appreciate and take very seriously, and that comes across in the programs that we offer, how we deliver them, and the resources that are available to students. And so by choosing the University of Alberta as a step in your post-secondary journey and towards your career, you can be rest assured that you are receiving a world-class education that is recognized internationally. So what are professional programs and what is offered at the U of A in terms of professional programs? So this term, it is quite broadly used and essentially refers to programs that lead you towards a very specific career, typically where some sort of license is involved in order for you to practice. So typically when we use this term, we are referring primarily to health sciences programs, but in some cases, you may also hear us use this term to refer to things like law, like the Juris Doctor program, for example. We won't be talking about that today, but just know that that option is out there. So the professional programs that we offer are sort of split between 4 different faculties. The faculty really doesn't matter. It's just how it's housed under our structure. It's really the program that you're interested in that is what matters. So the 4 faculties we have are the Faculty of Medicine and Dentistry, Faculty of Nursing, Faculty of ALES for short, or Agricultural, Life and Environmental Sciences, and our Faculty of Pharmacy. Then under each of these different branches are the programs that we offer. So for nursing, we specifically highlight our after-degree nursing. I'll just speak briefly about this because we won't jump too much into it during the session because we actually just hosted a session about this, so hoping there's not too much overlap. The reason why we highlight after-degree nursing is because this is specifically for folks who either already have an undergraduate degree or are coming to the end of completing an undergraduate degree and are looking perhaps to pivot into a new profession. And so this is a condensed program of only 2 years, whereas a regular Bachelor of Science in Nursing program would be 4 years. You still get the same education, you still write the same licensing exam, and ultimately end up as a registered nurse. Next up, we'll touch on dietetics. This is under our Faculty of ALES. This one we will go more in depth along with the other ones, so I'll just reference it briefly. So this program is for anyone that wants to become a registered dietitian, so someone who's super passionate about nutrition. Then we've got our Faculty of Pharmacy, which is our Doctor of Pharmacy program. This is the degree that you need if you want to become a pharmacist. And then under our Faculty of Medicine and Dentistry, we've got a few to review. So first is our Doctor of Medicine program. So this is your typical, I want to be a doctor, I want to be a physician. This program, they are very self-sufficient and do a lot of their own recruitment and admissions, and so we won't touch on this program primarily, just because we recommend that you reach out to them directly if you have any questions, and also because the applications for this program have already closed for this year. So it's a little bit counterintuitive to spend time chatting about that. Then we have medical laboratory science. So this is for folks that want to become medical laboratory technologists. So working in a lab and doing all of the tissue samples and examining them, but again, we'll touch on it more later. Radiation therapy leads to you becoming a radiation therapist, which is providing radiation treatment to cancer patients. And then we have our 2 teeth-related professions. So we've got our Doctor of Dental Surgery, which qualifies you to become a dentist. And then our dental hygiene program, which qualifies you to become a dental hygienist, thinking that folks are probably more familiar with those because hopefully we're all going to the dentist. So all of these programs require some form of pre-professional coursework to apply into them. And essentially what that means is you may need anywhere from 1 year, or in the case of the after degree or the Doctor of Medicine, all the way up to 4 years and a full degree of prior education before becoming qualified to enter these programs. But we're going to break it down program by program and figure out which ones are which and how long you need to prepare for each one so that there's no misunderstandings whatsoever. Before we jump into that, I do just want to quickly highlight scholarships and awards. And the reason for this is because there are some misconceptions about these programs not being eligible for scholarships and awards. Specifically for any program that is a bachelor's degree, so bachelor of something. That's every program I just listed with the exception of Doctor of Pharmacy and Doctor of Medicine is eligible for certain types of scholarships that are specific to transfer students. If you are interested in those other two programs, it's not that you're not eligible for those types of scholarships. There's still money available for you, but the process may look slightly different. So if you are someone who's going to be applying for admission for next fall term, next September, you're just going to want to keep these dates in mind because who doesn't love some free money to help us pay our way through our education? The application is just done online, uab.ca/awards. It becomes open to you after you've applied for admission and between the time period of February 1st and March 31st of every year. So just wanted to quickly highlight that and we'll move right into it. So the first program I'd like to chat about is our Doctor of Pharmacy program. So the way the Doctor of Pharmacy program works is it is a 4-year program in and of itself, not including the 2 years of pre-professional coursework that's required before that. This is also the same structure of the Doctor of Dental Surgery program, which we'll touch on later. Like I said before, this is the program if you want to become a pharmacist, both in Alberta, but just across Canada as a whole. And so the absolute minimum requirement for education is 6 years, but for some folks may take longer depending on their personal circumstance. So our pharmacy program is the only one in Alberta, and it's ranked in the top 3 of the pharmacy programs that are in Canada. One of the great highlights about this program is that you have experiential or clinical placements throughout all of the programs. Starting right from year 1, you're going to get out into your placements that are either in the community, the hospital, research-based, academia-based. You will also have access to a simulation lab and access to additional research opportunities as well. So what is a pharmacist? So pharmacists are medication experts and healthcare professionals. They focus on treating disease and other disorders primarily through drug therapy, but also just for overall wellness promotion and managing the state of diseases. In Alberta, pharmacists actually have the largest scope of practice across the whole country. And so what that means is the things that they are allowed to do is greater than that of other provinces. So one of the main differences here specifically is giving injections. And so although you do need to obtain an additional certification, which this program will prepare you for in order to give injections, you are then able to give vaccinations would be one of them, like our flu shots if you're traveling out of the country and you need any specific vaccinations, but also any injections that may be a part of your therapy regime. So for example, if like for some diseases like diabetes, you may need injections and things like that. So the scope of practice is much broader than it is in other provinces and really allows you to hone on in your different skills. So like I touched on before, pharmacists can work across a variety of areas. I think a lot of folks have a perception in their mind that pharmacists are primarily working in those community pharmacies, but they are integral members of the hospital system, of the long-term care system, of veterinary clinics, as well as sometimes people overlook, as well as working outside of the patient-facing roles, perhaps in pharmaceuticals, in government, in academia, and those sorts of things. So when our Doctor of Pharmacy program is looking through their applicants and looking through what qualities they possess, they are really looking for folks that have a strong passion for biology, chemistry, and mathematics. They do also have a passion for patient-focused and patient-first healthcare, and obviously have that desire to work in healthcare. One of the big selling points of pharmacy is that you can really establish yourself and your career with a work-life balance, and so that you're not giving up both your time because of training, but then also your time of when you're working, doing more of the working than of the living. And so this can be a great selling point for folks who, again, want to be involved in healthcare, but want to maintain that work-life balance for whatever personal reasons they may have. So I want to just quickly touch on 2 specific admissions pathways that exist for pharmacy, and those are our Indigenous student and rural student pathways. So the way these pathways work are is that there are additional, so in addition to the quota that already exist, seats reserved for these two types of students, so long as they still meet the same admission requirements as everyone else. So for Indigenous students, this is anyone who's First Nations, Métis, or Inuit and can provide documentation of that status. And then for our rural students, again, seats in addition to the quota is for anyone that in their teen years, essentially, ages 12 to 13, resided in a rural community. I will say the rural community definition is actually quite lax in the Doctor of Pharmacy program. So it's literally anyone who resided outside of Edmonton or Calgary. So even if you're joining us from like Fort Mac or Grand Prairie or Red Deer or Lethbridge, Medicine Hat, any of those still quite large cities, those would be considered rural communities. The reasoning for these admissions pathways is in Alberta, we recognize that we really need people to learn and study and become pharmacists and then re-enter those communities so that they can still be served, even though they're not the main metropolitan centers in our province. So in terms of the pre-professional requirements, again, along with dentistry, which we'll get to in a second, there is a hefty list of pre-professional requirements. What you'll see throughout this presentation is there is extreme overlap in the courses that are required. And so if you're still on the fence about which program is best for you, you may be able to still remain qualified for a number of programs while you're just still learning and understanding about yourself which program it is that you really want to choose. So you can see on the screen, I won't list them all off because I'm hoping that we can all review it on our own time, the courses that are required. And then the secondary requirement to these courses, which is 39 units or 39 credits total, is that you do still need to get 60 credits, which is 2 years of full-time coursework. But the remainder of those credits beyond the 39 can be in anything. They can be in electives. And so you can really choose courses you feel you would perform well in order to preserve your GPA and have the best chance of admission. Pharmacy uses a really holistic GPA calculation in that they calculate it 3 different ways to make sure they're giving students the best chance of showing themselves and showing what kind of student they are. So they're going to calculate your GPA on your most recent 2 years. They're also going to calculate it based on just the biological sciences courses. And then they're also going to pull the GPA of just your highest credit weighting year. So the year that you took the most courses, they're also going to calculate. You are required to create a letter of intent as well as participate in an interview. And then the one final step that sometimes catches folks out is a pharmacist consultation form. It's really quite simple. You download the form from the website. You essentially take that piece of paper into a pharmacy in your community and you sit down and you speak with the pharmacist. They'll hopefully give you a tour of the facility so that you can really, really understand what the profession is about and that we're hopefully not having folks that are applying to pharmacy as a backup program for something else. They really want people who are invested in using this as their career. And then at the bottom, you can just see a quick breakdown, which I sort of already reviewed, of how many years it takes to become a pharmacist, which is 6 at the minimum, before you then write your license and become a practicing pharmacist. So next we'll move on to both radiation therapy and medical laboratory science. These programs are both shorter length programs. So we discussed how pharmacy is 2+4. Both of these programs are 1+3. And so what that means is you do 1 year of pre-professional coursework and then 3 years in that specific program. I love talking about radiation therapy because it is truly an underrepresented career in health sciences and in healthcare, and it is so meaningful. You are providing radiation treatment to cancer patients, and in this country as a whole, not just the province of Alberta, we have a huge, huge problem with the number of qualified radiation therapists, so much so that in recent years, there's a number of patients across Canada that have had to have traveled to the United States to get treatment because we simply don't have enough radiation therapists. And so really drawn to promoting this program because of the impact that it can have on our family and our friends and people in our community. This program is very heavy on the hands-on learning. Honestly, the photo that I've included is a really good representation of said hands-on learning. Similar to a lot of the other programs, there is a virtual reality simulator that is used for radiation therapy, and along with the Cross Cancer Institute, or CCI is what you see on the screen, state-of-the-art training suite. And so these are both resources that can be used where you don't need an actual patient to practice, but you can still use the equipment and use the technology exactly as you would in practice. And then, similarly to the other programs we'll speak about, you will have actual clinical experience at centers across Alberta, which we'll go over which centers are available in just a moment. So again, what is radiation therapy? It's one of the three main treatment modalities for cancer patients. It uses ionizing radiation to destroy cancer cells by targeting the area that has by damaging that DNA. It can be delivered both internally and externally. So the types of people that we're looking for in our radiation therapy program are people that are highly compassionate, but also highly technical individuals. And so as you'll see, one of the requirements for this program is competency in physics, which I know isn't everyone's favorite subject, but is very important in this program. But at the same time, we need to have folks that are empathetic and can communicate effectively, especially when these patients are going through perhaps one of the worst experiences of their life. And you really need to be committed again to that patient and person-centered care. So just wanted to touch again on the radiation centers that are available across Alberta that you may be training at. It's in the majority of our major cities. So we've got Edmonton, Red Deer, and Calgary, and then also in northern Grand Prairie and in southern Lethbridge. Once you complete this program, you'll be eligible to write the certification exam, which is consistent across Canada. And so if you ever choose to move to a different province and wish to continue practicing, that is absolutely possible. And in some cases, you can also practice in other countries too. For this program, because it is 1 year of pre-professional coursework, you have exactly 30 units that need to be completed. They're listed here on the screen. And I just wanted to draw your attention, especially if some of you are joining us that are interested not just for this year, but for next year, that the requirements for radiation therapy will be changing for fall 2027. So again, not this year, but next year. Physiology, which is currently recommended, will become mandatory and will replace the psychology sociology requirement and also 3 credits of the requirement in physics. Beyond that, your GPA is going to be calculated again in 2 ways based on those pre-professional courses and then your overall GPA, especially if you have more than 1 year of post-secondary coursework. You also need to write a career reflection letter, which kind of discusses your intentions for entering this program and entering your career and what you hope to get out of it, and also participate in a multiple mini interview format. Moving on, next we have our medical laboratory science program at the U of A. I also love talking about this program because it's sort of underrepresented in that there are a number of institutions that offer medical laboratory studies, but they're typically at the diploma level, whereas ours is the only degree program in medical laboratory science in the province of Alberta. And there are definitely some pros to that, which we'll review in a moment. This is also a 1+3 program, so 1 year of pre-professional coursework and 3 years in MLS. One of our huge selling points for this program is for a number of years now, our graduates have enjoyed a 100% employment rate within 1 year of post-graduation. Part of this program is a 38-week clinical practicum where you're working with Alberta Precision Labs in the Edmonton area, and that's in your 3rd year. And then there's a compulsory research project in the 4th year, but the great thing about this research project is that you can select a project in an area that's of interest to you. And so you're not necessarily forced to study something that you have no interest in. So what is an MLT, or a medical laboratory technologist? If you've ever been to Alberta Precision Labs and the person that drew your blood and then the person that took it behind the scenes and tested it, that's them. Those are MLTs. So they sort and analyze and run tests on all types of samples. So that could be blood, urine, stool, for example, which are vital to healthcare decisions and diagnoses. Part of what's great about doing this program as a degree rather than a diploma is how much emphasis is placed on the 5 different areas of expertise. So not only are you getting the introductory knowledge to these areas of expertise, you're getting advanced knowledge in these areas. And those 5 areas are anatomical pathology, clinical chemistry, hematology, microbiology, and transfusion science. And to help you comprehend and understand what each of those things are, I've listed an example of what those tests would help us determine. And so, for example, clinical chemistry is the area of medical laboratory science that can help diagnose diabetes through a glucose test. Microbiology is more common with our especially transmission-based diseases, so strep throat, for example. And then transfusion science would be blood testing and typing, for example, someone going into surgery. Similarly to pharmacists, MLTs work everywhere, so they can work in hospital labs, private labs, public labs, then also work in academia or research, or again, veterinary clinic comes up once again as an example. So you can really explore those different options. The one of the program directors that we love, she has actually taken this degree that she completed at the University of Alberta. She's worked both in Canada, she's also worked abroad in the United States and across all of these different areas. So it really goes to show you how much of the skills are transferable and can be taken anywhere. So again, we have another set of 30 units of required coursework for MLS. You'll see the overlap in the biology, the chemistry, the English, the statistics. It's really quite consistent. One of the requirements for MLS is that these courses absolutely have to have a minimum 2.7 GPA just in order to sort of move past that first qualifying stage. And then they will also calculate your overall GPA, which also has to be at least a 2.7. I will give the disclaimer that I've listed the minimum cutoffs for these programs, but the competitive averages can be much, much higher than this. But these programs are quite transparent about what that is. And so you can find the information about the competitive averages based on the previous year's admitted group just on their websites. This program also has a letter of intent and also does an interview as well. Next up, we have dental hygiene, and we'll move on to dentistry afterwards as well, which I'm assuming a lot of folks will be familiar with, so we'll keep it short and sweet. So, in the dental hygiene program, you'll be taking courses in biomedical, behavioral, and oral health sciences. You have access to a simulation laboratory, just like the other programs. But one of the great things is that we actually have a dental and oral health clinic on campus that real patients from the community come to receive their services, and that's where you'll be practicing. Beyond that, you'll also be practicing in external locations, but I think it's really great to have that on campus and be a part of your program. Dental hygienists perform teeth cleanings, they apply fluoride treatments, they take x-rays, and overall just educate patients on oral health. This program is also a 1+3 program, so 1 year of pre-professional coursework and then 3 years in dental hygiene. One of the requirements for dental hygiene is that they are looking for this year of pre-professional coursework, or if you have more than 1 year, that's okay. They need to see at least 1 year that has a minimum of 27 units. And so what they're looking for is that folks can handle a full-time course load because there is no option to study this program part-time, and they want to see that you can keep up with the demands of that academic program. They also have a minimum overall GPA of 2.7, but I'll be completely transparent in saying that this is a highly popular program, and so the competitive GPA is much higher than this. This, along with dentistry, you'll be required to complete the Casper test, which is a personality and situational judgment test. It's done online and it's administered through a company called Acuity Insights. You'll also be required to share some personal experiences in employment, leadership and volunteering, life experiences and achievements, and just personal highlights about yourself. And then based on your grades and your Casper test, you would be invited for the last stage, which is an interview. Now, for the Doctor of Dental Surgery or Dentistry, just for short, you would be taking courses in oral biology, dental anatomy, and oral pathology. This is the same as pharmacy in that it's a 2+4 structure. And so the absolute minimum number of years of education required to become a dentist is 6 years. Similarly, you have access to that simulation laboratory, but again, also get to work in the on campus clinic and assist in that clinic with upper year students when you're a lower year student. A part of being a dentist is diagnosing oral and jaw conditions, developing treatment plans, and then interpreting those x rays that we heard that the dental hygienist may be taking of patients. So, the pre professional requirements again, you need to take 60 units or 2 years of coursework. But beyond the courses that are listed on the screen, you can fill any empty space with electives. The requirement for dentistry is that you have to have either these 2 years or another 2 years that are 30 units per year. And it's for the same reason of this program is highly intensive. It's completed on a full-time basis, and they have to see that you're able to handle that. The minimum overall GPA for this program is a 3.3. You'll be required to complete the DAT or the DAT, the dental aptitude test, as well as the Casper test. And similarly, you will write about your personal experiences and then be invited to complete an interview and a personal statement based on the evaluation that's taken place so far. And then last but not least, before we move into some Q&A, is our Bachelor of Science in Dietetics specialization. This is the program that leads to you becoming a registered dietitian, and it stands on its own as a 1+4 program. So 5 years minimum to become a registered dietitian. Registered dietitians are absolute experts in nutrition and metabolism and have a strong focus again on that healthcare, patient, and person first approach. There's a very heavy emphasis on applied sciences and specifically the ability to communicate and translate things that are very scientific, very medical into practical applications for patients to understand. Part of this program is 44 weeks of practicum, both in rural and urban placements. That is why it takes an extra year to complete this program, and you have access to our world-class research facility, which is the Human Nutrition Research Unit. The list of pre-professional requirements is slightly shorter for this program, but again, under the same buckets of your chemistry, biology, English, statistics, and whatnot. And any additional courses can just be electives. The minimum GPA is a 3.0, and it's just going to be based on your most recent coursework. So if you're someone that's planning to only do the first year and go straight into this program, it would obviously be based on that. But if you're someone who's done more than 1 year or even has a whole degree, just know that it's going to be based on your most recent representation as a student. You also have to have at least 2 semesters of full-time student status and will complete a multiple mini interview as a part of the application process. So, if any of you are interested in applying for fall 2026, then the application for admission for most programs, except for Doctor of Medicine because it's already closed, is open now. We'll go over the deadlines shortly. Applications are all submitted directly online, directly on our website at uab.ca/apply, and the portal is called Launchpad. It's, in my opinion, quite simple to work through. There are very obvious headings that need to be completed and shouldn't take you more than 45 minutes to an hour. About those dates and deadlines, so I've split it up into when the applications open and when they close. At this point, all applications are open, so we don't really need to focus on that. In terms of application closing, ones that are coming up quickly is your dentistry and your dental hygiene. It's literally closing in 3 days on November 1st. The rest of them follow the more typical application timeline, which is March 1st, and then our 2 programs that are radiation therapy and medical laboratory science actually have an extended period of admissions. So that's to March 15th and April 1st, respectively. Last but not least, if you need to get in touch with us or you want to get in touch with us to discuss any of these programs, there's a few ways to do that. So the first is going to be through virtual advising. You can go to our website, which is uab.ca/advising. You're going to scroll down and you're going to see a box that says not sure what program or something along those lines, and it's going to say click here to book general advising. You can click there, but what you really need to be aware of is making sure you're signing up for transfer student advising. And the reason I place emphasis on this is because in that same page, you're going to see high school student advising. So make sure you're signing up for transfer student advising. You would likely get me as your advisor or one of my colleagues, Teo. And this is just because these programs are our specialty. And so we're best equipped to help you through this process and answer any questions. If you're not a fan of the virtual advising, you can also send us an email. Our email address is transfer@ualberta.ca. You also have the option of reaching out to the faculty directly. Their emails are on their website. And then, if you just need a starting point in order to guide you out, our transfer webpage is the best place for that, uab.ca/transfer. On that page, you'll have all of these faculties hyperlinked that you can just go straight out into the programs that we discussed. And if you feel so inclined, you're more than welcome to scan the QR code to sign up to receive important information from us. I will just say if any of you received an email invite inviting you to this session, no need to scan the QR code. You're already in our system. But if any of you found this session through social media or through our website, you may want to so that you can be notified of events like this in the future or of any other important information about admission requirements, timelines, and things like that that we need to share with you. So that is the end. I'm going to stop sharing my screen just so it's a little bit easier for us to do the Q&A session. And I am